Yeah, and then stand them square. It's quite. Yeah. So you've got the temporal mandibular joint, you've got the wing of atlas, transverse processes of C3, C4 and C5, dorsal processes of withers, spine and scapula, greater tuberosity of humerus, deltoid tuberosity, lateral epicondyle of humerus, accessory carpal bone, tuber sacral, tuber coxae, tuber ischii, greater trochanter, patella, lateral condyle of femur, lateral malleosis of tibia, and the calcaneal tuberosity. So we've got the masseter. This aids in the process of mastication. It opens and closes the mouth. This is the rectus capitalis manchalis, and it helps with lifting the head up. So then we have splenius. This aids with lifting the head and bending the neck. So you have the cervical part of the trapezius. This aids with pulling the shoulder forward. Thoracic part of the trapezius, and this aids with pulling the shoulder up and backwards. This is the sternum cephalicus, and it aids with lifting the head. This is the rhomboideus, and it helps pull the scapula backwards and up. It also helps with lifting the head. This is the brachiocephalicus. It helps with moving the head from left to right and bringing the shoulder forwards. So this is the serratus in the cervical part, and the thoracic part sits here. So this is the thoracic part of the serratus. This is the supraspinatus, and it helps with aiding the limb during movement. This is the infraspinatus. It abducts the limb and helps support the shoulder. This is the pectorials, and it aids in bringing the forelimbs forward. This is the triceps brachii, and it helps with extension of the elbow. This is the biceps brachii, and this helps flexion of the elbow. This is the deltoid, and it helps flex the shoulder and abduct the arm. This is the latissimus dorsi, and it pulls the humerus back and up and helps with flexion of the shoulder. We've got the longissimus costium, which helps and aids in respiration. The longissimus dorsi, which lateroflexes the back and neck, and together extends the back and neck. Tensor fascia latae helps with movement of the hind limb. The middle gluteal, and it extends the hip and abducts the hind limb. Biceps femoris, and flexes the patellar joint. This is the semitendinous, and it flexes hip and extends the hock. This is semimembranous, and this extends the hip and abducts the limb. Either side of the splint bone, you have the palmar distal arteries. The lateral cartilage sits around the coronary band. The annular ligament supports the carpal radial joint and sits underneath. The superficial digital flexor tendon. The deep digital flexor tendon that runs on the inside of the superficial flexor tendon. The suspensory ligament. So you have the branch of suspensory ligaments that comes off of the suspensory ligament. Medial and lateral collateral ligament that sits in front of the annular ligament in the fetlock joint. lateral common extender tendon that runs down the front. When working with horses, it's important to work quietly, empathetically and safely with them. Horses are extremely sensitive. You should always make sure that you have the correct clothing, boots and restraints. Assessing a horse's temperament and behaviour is also important to prevent injury. You should consider the environment that you're working in. Is it clear, free from distraction? How noisy is it? Are there other animals around? Before approaching, think about what you're going to do and how you're going to do it. It's important to communicate with the horse through touch and with your voice to make sure they feel at ease. You should always approach a horse from the side towards the front, as they're able to see you and their surroundings at the same time. Standing or walking directly behind a horse increases the risk of being injured, and the horse may strike out or turn or bite. By using a hand as a safety guard when working in places a horse may feel threatened, for example around the hindquarters, or areas that may be painful, considerably lower the risk of injury. To conclude, be confident. If you are, the horse will be too. Set ground rules and stick to them. Be alert and plan. Don't become complacent, as this causes unreasonable risk. And constantly be on the lookout for demeanour changes and the horse's reaction at all times. Animals experience hunger, thirst, fear, sickness and injury, and strong maternal instincts. They also develop individual behaviour patterns such as kicking or biting. The handler should be aware of these behaviours and take necessary safety precautions, including using personal protective equipment. It's important to observe a horse before treatment to assess their behaviour. Is the horse calm or is it anxious? Observations of the horse allow you to plan how you're going to handle the horse. Before handling the horse, you should assess the surroundings, making sure the environment is free from hazards, distractions, noise and other animals. Anything that could potentially cause the horse to become stressed or uncomfortable. A stressed horse is a dangerous horse and could result in injury. This may mean moving the horse to a quieter location or moving hazards out the way, such as wheelbarrows, forks or buckets. It's important to assess that if there's other animals in the vicinity, is this going to be distressing or cause a distraction? Hygiene is really important when handling horses. Wearing protective materials such as boots and gloves can safeguard you against disease. Sanitising your hands and washing your hands at regular intervals and using foot washes where possible are also really important. Not only does this safeguard you and the handler from potential zoonotic diseases, but also the horse, as you will be working at multiple yards with multiple horses. Health and safety precautions should be taken to ensure the safety of the horse, handler and therapist. Having appropriate PPE such as boots, gloves, appropriate clothing is important. A handler should be aware of the safest position to be in. When holding the horse for someone else, both of you should remain on the same side. Do not wear jewellery, strong perfume, as this may distract or cause the horse to become agitated. Appropriate restraints such as bridles, halters and lead ropes should be used. This will ensure the safety of the horse and handler and the therapist.